All right. Welcome everyone. Mayor Matthew Anesh on behalf of the South Plainfield Mayor's Wellness Committee. I'd like to welcome you to our first webinar. These meetings are being recorded so that residents can join at a later date of their time and choosing. I'd also like to thank Hackensack Meridian Health for their partnership throughout the year and especially tonight. Today's format will consist of a 30-minute session with about 5 minutes or 10 minutes left at the end for questions. You can utilize the WebEx raise hand feature, and when called on, you can state your question. If you would like to, you can also use the chat function, and the questions will be presented at the end of the meeting to the doctor. Now I'd like to welcome our guest speaker, Dr. Anush Mishra. He is the Regional Chair of Hackensack Meridian Behavioral Health and a Carrier Behavioral Health at Raritan Bay Medical Center. So Doctor, welcome, and you are presenting today on what is often referred to as DAD, correct?
Correct. Yep. Thank you, Mr. Mayor, and thank you, Laura, for helping me with this presentation. And good evening, everybody, whosoever is attending today. I'm really very pleased to be here to present this rather very timely topic. You know, we are in the middle of the winter. Winter has been a little harsh this time, and what we are going to talk about is right in front of you on the screen. We are going to talk about mainly mood changes related to seasonal changes, I would say. And in medical terminology, we call it seasonal affective disorder. So first of all, I will be describing what seasonal affective disorder is, and then we'll go over certain things such as how to recognize it, what causes it, and finally, the most important part, that if you have it, how to deal with it. And towards the end, as Mr. Mayor said, that we will have some time to have some discussion. But even if we are not able to take your question today, anytime you have any issues, you can always contact us, because we'll be giving a lot of information about resources available within HMH. Laura, next. Basically, let's first of all discuss in brief, what is seasonal affective disorder? Actually, seasonal affective disorder is change in your mood, activities, and behavior related to changes in season. Now, generally, it is related to, people think that it's only depression, which comes with winter. All sorts of variations are possible, because seasonal changes in your mood sometimes can lead to manic episode and hypomanic episode, although depression presentation is the commonest one. And the seasonal pattern you can also see with summer depression, that every time in the summer, the person gets depressed. So basically what we need to understand is that when there is a consistent pattern in which the patient's mood and activities and behaviors change in relation to change in the season, that is called seasonal affective disorder. And most common variety of that is that people generally feel depressed with the onset of winter season. Next slide. So let's again talk a little bit more about how common it is, who is likely to get it, and all these details about seasonal affective. Now, up to 40% of the people, meaning approximately half of the people, may report that mood declines as the fall and winter approach, and 20% of them may report that they have become more moody and they're not willing to do the activities which they commonly do. I want to differentiate that this is normal, this is temporary, and we call it winter blues. Now, here I would like to say one more term which we commonly use, and which is called holiday blues. We should not confuse holiday blues with seasonal affective disorder or winter blues. There are seasonal changes in your mood and activities, while holiday blues, as we all know, come December time, and there's a lot of stress related to holidays, and people may start feeling depressed and anxious. So that is another one. So just wanted to differentiate. But winter blues, which affect to 40% or maybe slightly more seriously to 1 in 5 person, that is temporary and self-limiting. That is simply we refer to winter blues. But when it becomes more persistent and take the form of a psychiatric syndrome, it is called seasonal affective disorder. And we already discussed this, that generally it occurs in the winter, but it can also occur in summer. There's no rule about it. Sometimes geographical location can affect, and studies are shown that Alaska has the highest rate. So more northern the latitude you move to, more chances of having winter blues and seasonal affective disorder. Now, another thing is that gender-wise, women are more likely to experience seasonal affective disorder compared to men. It is more likely to affect younger population compared to older population. Next slide. So now we know that what seasonal affective disorder is, and now I'm talking about is SAD, seasonal affective disorder. Now we are not referring to winter blues. So now we know who gets it, when it is likely to happen. Let's see how we can find out whether we do have symptoms of seasonal affective disorder. And one thing I want to make sure, seasonal affective disorder is not a separate diagnosis in psychiatric prevalence. Basically, it is a variety of depression syndrome. We have diagnosis of major depressive disorder. So seasonal pattern is a variety of major depressive episodes. So you would then expect that symptoms are going to be similar to what a person experiences in major depressive disorder. And these are the symptoms which are listed there, which are common to both major depression as well as seasonal variety of it. The only thing I'm sure you are able to see that I have highlighted a few of them in blue font. So please focus attention to those because those are more commonly seen in seasonal variety of affective disorder or mood disorders. As you can see, any depressive disorder is diagnosed based on presence of depressed mood and loss of interest, along with having multiple other symptoms which are listed there. And I will not just list all of them because they are there. You can, while I'm talking, you can read about. But generally, I want to point out that in seasonal affective disorder, you will see the sleep changes mainly towards increased sleep, not decrease in sleep. Same way, appetite changes towards more appetite or increased appetite rather than decreased appetite, which can happen in other types of depression. And this appetite change is rather peculiar, in seasonal variety of depression. You specifically crave carbohydrates. So that is somewhat particular to seasonal variety of depression. And the last thing is that lack of energy is there in any variety of depression, but in seasonal variety of depression, social withdrawal is extremely common and lack of energy is there. And it is similar to in other species, hibernation period. So a person almost is hibernating, does not want to socialize, does not want to do anything. And apart from that, there are so many other symptoms which are common to all patterns of depression, which are listed there: hopelessness, worthlessness, guilt. And more importantly, everybody has to remember that depression is not something not to pay attention to, because in the end, it's a deadly condition if untreated and can result in suicidal ideation and even completed suicide. Next. Let's talk about what do we know about what causes seasonal affective disorder. Now, as in most psychiatric disorder, we do not know completely what causes psychiatric disorders. Certain things which we know with scientific advances. And one thing we definitely know about depressive illnesses or mood disorder in particular, that definitely a big chunk of positive factors come into biological area, meaning changes in your brain biochemistry leads to depressive symptoms. And that is true also seasonal affective disorder. changes in your brain biochemicals, which is possibly responsible for the symptoms you experience. And first and foremost is that I think that nowadays it is common knowledge that we treat depression with medications called SSRI. SSRI medications are which increase the availability of a brain chemical called serotonin. So expectedly, even in seasonal affective disorder, uh, serotonin in the brain, its availability is reduced, and that is considered a cause for depression. Second thing, as probably you are already aware, that sun exposure results in our bodies manufacturing vitamin D. So, and that is why going out in the sun is always better. Not having exposure to sun can lead to vitamin D deficiency or low levels of vitamin D, which can again result in lower serotonin activity. And as you would notice, that low serotonin is associated with depression. Now, another biochemical, which is called melatonin, again, it's a over-the-counter medication, so everybody probably is aware of, is again a brain chemical which induces sleepiness. But in seasonal affective disorder, it is known that melatonin levels are higher, and that probably can explain sluggishness and sleepiness, which happens in seasonal affective disorder. Now, another biological factor which may be causing seasonal changes in mood is what we call circadian rhythm. Basically, our bodies work in a 24-hour cycle. It's a biological cycle which repeats every single day. Lots of hormones are released based on the timings of the day. Sleep pattern is established based on that. So, because when the winters come, what happens is that the days get shorter, meaning daylight times shorter, and it may disturb your circadian rhythm, biological rhythm, which again is hypothesized that may be the cause of seasonal changes in mood. These are biological causes we can think of depression in seasonal pattern. But then there are other social reasons may also be contributing to it. Like when there is winter and there is snow all around, you don't go out and you're not doing enough activities and exercise. That itself can lead to depression. Same way, you may get isolated in winters because of simply because of the season, and you may not be with your family members and friends, and that can also impact your mood. So, like any other psychiatric illness or disorder, it could be multifactorial, biological, and social social factors resulting in changes in your mood. Next slide. Well, now once we have talked, now we know what may be the symptoms of seasonal affective disorder. Let's just briefly, we have very limited time, so we'll not spend too much time, and I'll finish by 7:20. How to cope with seasonal affective disorder. First of all, don't get too concerned for winter blues, because generally speaking, it should be time-limited, temporary issue, and you should get over it. But certain things you can do if you see a persistent pattern of symptoms. One is stick to your regular schedule, where basically go on time to the bed and wake up on the same time, and that keep your circadian rhythms and your biological rhythms in order. And go out in sunlight, as much as you can. Or even if you stay at home, don't remain closed in. Let the sunlight come in. And I just want to add here one thing which people may not have, awareness of, that what if the day is cloudy? Even cloudy day, you get sufficient sun exposure, so to say. Just for an example, the way we measure light intensity is in lux. Suppose it's a full daylight sunlight, there, you get about 10,000 lux exposure. Even on cloudy day, you get up to 4,000 lux exposure. So don't think if it is cloudy, it is of no use going out. You can still go out. And compare this with when you are indoors and you have just lights on, like I'm sitting right now, the exposure is between 250 to 500 lux. So even going out or letting the sunlight come even on cloudy day may be beneficial. Next one, again, it's a general tip, staying active. Again, I'll tell you that forget about only seasonal affective disorder. For all depression, all varieties of depression, we know very clearly that exercise is almost as effective as antidepressant. So we should not let go of that simple tool at our disposal, which can help with the depressed mood. Now, because as we talked about that in seasonal affective disorder, appetite is increased, and especially, you crave carbohydrates, be mindful of sugar intake, try to avoid it. And even if you have to eat something sweet, try to eat something which is meaning more complex carbohydrate rather than plain sugar. Another two advices are simple. Basically, you reach out to your friend to remain socially engaged, and don't just fall for texting and just isolating yourself more and more. Basically, remaining active and remaining connected is a very good tool to prevent depression from occurring. Next. Now, then the question may come that when should I seek medical advice or professional help? And as I said, knowing the symptoms will help you in this direction. Generally speaking, we talked about winter blues. Don't get too much worried about it. Just keep an eye on this. That is it really getting more persistent and severe? When the symptoms become more persistent and stay there for weeks, as a guideline, I will say, for diagnosis of major depression, we do require approximately 2 weeks of continuous symptoms. So if the symptoms are persistent more than 2 weeks and they are severe enough to affect your functioning, then definitely it's time to speak with a medical professional. Some things I would suggest right here, that if you feel that you have these symptoms, then definitely seek help as soon as you can. And one is definitely that you are not able to function in your whatever role function you have as a parent, as a worker, employee, whatever role you have to play, and you're not able to do it. Definitely, if you're feeling suicidal, you definitely have to seek help. And sometimes even extreme weight gain, weight loss, and feelings of hopelessness, worthlessness are the symptoms that you should seek help. And then again, we will not talk too much about the treatment. What doctors or medical professional can suggest you. They can suggest you what we call light therapy, and they can also suggest you seek what we call talk therapy or psychotherapy, which is a very effective tool. And the doctors can prescribe you some medications and vitamin supplements, especially vitamin D, as we just discussed, that vitamin D deficiency can, or low level vitamin D can result in lower level of serotonin and may result in depression. So doctors may think about any of these modalities. And just 2 words about light therapy. Light therapy can be done by exposing the person to the bright light. And also there's another way to do it, which we call dawn simulator, meaning it just tries to artificially simulate as if you are being exposed to dawn when the light comes gradually in natural circumstances. And just another thing I will say here is that all these treatment modalities, light therapy, talk therapy, medications, they are all known to be effective treatment, and they can also be helpful in preventing further episode of seasonal affective disorder. Next. That's about it. Here we have listed we have very big presence of behavioral health services at our Perth Amboy campus, Raritan Bay. And we have inpatient unit, outpatient locations are at Old Bridge and Addison location. Next, Laura. And we even have urgent care. So these are resources listed, and again, Laura will be leaving all these resources with the mayor's office. So you can always contact us, and as much as we can help, we'll definitely help our community. Thank you very much for your time, and I hope that this was useful. I'm ready for any questions you have.
Yes, thank you, Dr. Mishra. You can hear me, correct? Okay, perfect. So yes, thanks. A lot of I think useful information for our residents, and a very well thought out and good presentation. As I was thinking of questions as you kept going through, you were answering a lot of them that I had. So I think your presentation is meant to do that. We do have some questions that have come in through our chat, but I still had one that I thought of. Just curious if you or generally the industry is seeing a general increase in SAD or even other just general depression due to the shift we've seen into the work from home model after the COVID pandemic. Clearly, a lot of people are working sometimes 3 days, sometimes more from home. So as you mentioned, a lot of what you would suggest for people to do to cope with this is to kind of get out, and a lot of people don't like that. They don't like the winter, and they try to avoid as much as possible. But when you're working, you kind of have to. You used to anyway. Had to go out and kind of bear the elements and go to work. So have you seen like a general increase, in SAD or anything? Just maybe related to that.
Yeah, actually, there's a lot of literature indicating that increase in depressive and anxiety disorder, and that has coincided with advent of COVID in 2019-20, and since then it has persisted. And meaning theories are definitely on the same lines as you're saying, that social isolation, disconnection, lack of activity, because really, as you said, that otherwise we had to face the elements, we had to go out, and you have to be with people. That is not happening, and that is why in my last clinical slide, I said that so many services available that you can call the DoorDash for everything, and you don't even have to go out. So basically, even if you have to go out to get your pizza, you have some interaction, and that is not happening nowadays. So you are absolutely right. We have definitely seen an increase in depressive and anxiety disorder related to working from home, related to again pandemic.
Oh, thank you. So a couple of questions that came through. What about taking vitamin D as a vitamin? Does that equate to time in sun, and do like daily vitamin D supplements help avoid symptoms of SAD?
Absolutely. See, the thing is, I will qualify my answer a little bit. Yes, it will help if you are deficient in vitamin D. If you have sufficient level of vitamin D, it is unlikely it is the cause of your depressive symptoms, and it is unrelated to even seasonal affective disorder in general also. So my suggestion is that it is suggested that we, especially when we are growing older, about 60 plus years of age, we have a multivitamin. And obviously, if symptoms are there, then your vitamin D level should be checked and it should be replaced to get it to the normal level. And one last thing I will say about vitamins, that if you simply take a simple multivitamin that has vitamin D in it, and you need vitamin D separately only if you are deficient.
Okay. Good point. Another question that came through chat: how does diet impact SAD?
Diet As such, I would not say that it will either or prevent or cause SAD or any types of depression, but as we saw, it is a symptom of depressive disorder in general and seasonal affective disorder. Sticking to a healthy diet is a good advice, basically, because it remains within the normal range and your activities remain there. Generally speaking, if you are sticking to a healthy diet, you are getting all the nutrients, vitamins which are required by the body. So that, having said that, I will not be able to say that if you have certain types of diet, it will prevent that from occurring or depression from occurring, or you can actually prevent any of these syndromes. On the other hand, if you are suffering from depression or a seasonal variety of it, you are going to have changes in your appetite. And both ways, I would suggest that you have to be cautious what you do with that. Some people have extreme lack of appetite or anorexia. So in those circumstances, you have to keep nourishing yourself to the optimal level. And on the other hand, in other types of depression, including seasonal variety, you may have increased appetite and you may be eating so much that it causes increase in weight, especially carbohydrate craving, as I said. So in those circumstances also, we have to mind what we are eating. So healthy diet is always healthy.
Thank you. One additional question coming through. Actually, we got a couple more. One of our council members here. How much of a factor is physical fatigue and lack of play? How does that affect SAD and I guess one's likelihood of getting it?
This is a very good question because this is also cause and effect. Cause maybe effect is, as we already saw, one of the symptom of seasonal affective disorder is patients feel almost like hibernating. They don't have any motivation. They don't have any energy. That is, it happens as a syndrome or as an illness, part of the illness. But on the other hand, if we remain inactive, we are inviting more depression. So yes, fatigue is a symptom of it. Continually remaining inactive is likely to further worsen the symptoms. So even if we have to go a little extra hard on ourselves and remain active, it will always be helpful. Both cause as well as effect, seasonal effect.
Okay. Here's an interesting one, Doctor, from one of our members of the committee as well. Do you recommend treatment via telehealth, or is face-to-face better, or is there no difference? Does it matter?
So let's say this thing. Activity standpoint will be good that you get out. You will have to do many things. So that one will be. I had to say this thing, and it's such a good question in today's circumstances. Availability, you don't have availability. You even want treatment, but there's nobody available in your neighborhoods. So in those circumstances, telehealth is a tremendous tool, and we have been utilizing in our own hospital telehealth services. And there is no indication, I had to say this thing, that telehealth is in any way inferior in providing the outcomes which you will get from face-to-face in behavioral health. So it's purely my suggestion, that if you have availability in a timely manner, and again, I will say this thing, that I would not like to delay treatment if you are having serious symptoms, simply because there is no face-to-face provider available for 2 months. In that case, I would rather have an appointment with a telehealth. So only my suggestion as a person, or even as a doctor, if you can get an appointment in a timely manner, you can see a person face-to-face. Don't delay by any means, and telehealth appointments are equally effective.
Thank you. And just, I think, possibly one last question, Doctor, in case any come through. Yeah, on the slide you had mentioned women were 4 times, more prone, and then young adults, 18 to 30, were more susceptible to SAD, which both of them I kind of find interesting. Do we know, or is the profession, the professionals have, a thought behind why that is the case?
Let me actually, I will not be able to give exact reason because we really don't know.
Yeah.
This is true.
Okay.
Say like women are more likely to have all varieties of depression compared to men, compared to some other psychiatric illnesses which are pretty evenly distributed, like schizophrenia. The incidence is almost the same, both men and women. But depression and anxiety disorders are heavily more commonly seen, meaning are more commonly seen in women in general, number one. And second thing is that onset of all depressive illnesses is also in the younger age group. And that is why probably we are seeing that yes, these two age group and women are more susceptible, because generally this is the presentation for all depressive and anxiety disorders, which start early in your life and most commonly seen in women. So apart from that, I will not be able to give any biological reason that why exactly these two groups should suffer more seasonal affective disorder.
Yeah, and Justin, for me, the young adults kind of was shocking, because you would think the younger of us would be more prone to being outside, enjoying the environment, even in bad weather, even during the winter. And as we get older, you would think people would be more likely kind of avoid that. But it's interesting that you're seeing that that it's more susceptible at the younger age. So, yeah. Again, I know they're not expecting you to have an answer for those. It's just kind of an interesting, point that we found. We do want to thank you for your time on behalf of the entire Mayor's Wellness Committee, and on behalf of myself, and on behalf of the residents of the borough of South Plainfield. We do also want to thank Hackensack Meridian Health in general for their great partnership, like I said, not only for tonight, but through the health fairs that we do throughout the year, through all of the programming that we have at the Senior Center, where, the hospital, and the organization is a great partner in bringing all of this to our residents, and not just to our residents, but to the residents throughout the entire state and the greater area here. So again, I want to thank you for your time. As I mentioned, these will be up on the borough's website for residents to enjoy. It's a great slide that we're leaving on here. You have some great information where you can go and find additional questions or additional answers to anything that might be on your mind. Again, we will have what I would ask for residents to do is just maintain connection with our Facebook page and our borough X account, social media accounts, and also the borough website. As we schedule the next webinar, we'll be able to present to you what that topic is and also the date, and it'll follow the same pattern here, and also we'll make those available. So again, thank you for your time. And before we end the meeting, Doctor, I'll just leave it up to you if there's any last words or anything that you want to leave our residents in the community.
The only thing thank you, Mr. Mayor, for giving me this opportunity, and also to HMH to come and present. It's important. Only thing I will say, I've been a psychiatrist most of my adult life. The symptoms of depression and anxiety, they interfere with quality of life and your function. And as I said earlier on, that in some cases, it can result in very poor outcomes. So do not neglect symptoms, seek help, because help is available, and it is effective help, it is not something which doesn't get you anywhere. It is very effective help, everything, quality of life as well as maintaining function. Please do not neglect the symptoms and seek help as needed. That's it from me.
Thank you, Doctor. And that'll end our program. And again, stay tuned for future program, future webinars. Everybody have a good evening. Thank you.
Thank you. Thank you, Laura.